हेलो गुड मॉर्निंग मैं डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के सम इम्पॉर्टेंट एमसीक्यू. A 16-year-old boy presents to you with compression nasal obstruction and a frequent nose bleed. CT scan shows hollow Miller sign. You suspect a benign tumor of the nasopharynx. What is the most common site of origin? Maxillary antrum, sphenopalatine foramen, anterior wall of the sphenoid bone, roof of the nasopharynx. The best answer is sphenopalatine foramen because here the unique clinical scenario along with the CT scan showing the polar Miller sign such to have diagnosis of juvenile nasopharyngeal angiofibroma. Juvenile nasopharyngeal angiofibroma. GI, that is the most commonly arising from the sphenopalatine foramen. From there is the tumor origin from the nasal cavity, nasopharynx, and the infratemporal fossa, and petropalatine fossa, and petromaxillary fossa. Next question: the only branch of the external carotid artery which is given from its medial side is superior thyroid artery, facial artery, ascending pharyngeal artery, and lingual artery. The best answer is the ascending pharyngeal artery. So the only branch of the external carotid artery which is given here from the medial side is the ascending pharyngeal artery. And the external carotid artery is a branch of the common carotid artery which benigns at the upper border at the thyroid cartilage at the level between the third and fourth cervical vertebra. Branches the external carotid are like the superior thyroid artery, ascending pharyngeal artery, lingual artery, facial artery. Next question: a 30-year-old woman is diagnosed with a high-graded squamous interepithelial lesion of the cervix and no obvious macroscopic growth. What is the next line of management? Hysterectomy, conjugation, colonoscopy, and biopsy. Follow up after 6 months. Best answer is the colonoscopy and biopsy. In a woman diagnosed with the high-grade squamous interepithelial lesions, the next step is management. What? Perform the colonoscopy and biopsy. Patients who are found like to with the HSIL are further subjected to biopsy. This is done by colonoscopic study. For the visual inspection, the acetic acid. If we need to the visual inspection, we need to the acetic acid. For aceto white areas and taking biopsy of normal areas. Next question: a 76-year-old woman has been scheduled for hip replacement surgery. She was a history of non-valvular arterial fibrillation resulting in a stroke 2 months back and she on warfarin since then. Which of the following is the correct advice regarding warfarin? Stop warfarin 4 to 5 days pre-operative and check INR. Stop warfarin in a 4 to 5 days pre-operative and continue LMWH till a day before surgery. This is the best answer. Because since the patient has increased the thromboembolic risk, stroke warfarin is stopped 4 to 5 days pre-operative and low molecular weight heparin is used till the day before how much? 24 hours. In a patient with a high risk in thrombus, example those with the certain mechanical heart valve implant or with the atrial fibrillation and prior thromboembolic stroke, warfarin should be stopped and replaced UFH or LMWH to minimize the risk. Patient who have the lower risk of the thrombosis may have warfarin discontinue 4 to 5 days pre-operative. Discontinue 4 to 5 days what pre-operatively and then retained after the successful surgery. Next question: a patient with a history of ischemic heart disease now comes to the hospital due to problem with vision. She complains that while turning her head, the image of the previous target still persists for the few seconds before she can see the new target. This phenomenon is seen in which of the following condition? Anton syndrome, Parent syndrome, Perniosis, and Claudia syndrome. This is the Barnett syndrome. The persistence of visual image even after shifting gaze is called the palinophasia. It is seen in Balint syndrome. Balint syndrome results due to low flow in water vast areas due to the distal PCA, and MCA territories. It is characterized characterized by the following things like the palinopecia, persistent of a visual image is uh, uh, despite gazing for another scene. कैसे कैसे होता है? Palinopsia, palinopsia, smiltagnosia, miltognosia, optic ataxia, ocular apraxia से होता है. Ocular apraxia means inability to direct gaze inoculated to a new target. Optic ataxia means inability to reach accurately under visual guidance. And asmiltogenesis difficulty to focus on more than one item in the visual field. And palinopecia persistent to the visual image despite gazing to another ones. Once more, ocular apraxia inability to direct gaze accurately to a new target, and optic ataxia inability to reach the accurately under visual guidance. Asmiltogenesia difficulty to focus on more than one item in the visual field. Asmiltogonosia क्या होता है? Difficulty to focus more than one item in the visual field. Palinopsia persistent of a visual image despite gazing or another sense. In Claudia syndrome is distinct to brain state syndrome characterized by the ipsilateral थर्ड नर्व. इन क्लाउडे में क्या डिफरेंस होता है? इप्सिलेटरल जाता है, सेम साइड जाता है क्या? थर्ड नर्व विद कॉन्ट्रालेटरल हेमी अटैक्सिया, कॉन्ट्रालेटरल हेमी अटैक्सिया. It is due to the intrinsic or extrinsic lesion in the midbrain. The important note point here, the while some authors use the term sematogonosia, others use asematogonosia. Instead of few others also are used to tag terminologies interchangeably. So don't confuse here. Okay, so today that's all and keep revising.